Two main groups of patients I would refer for upright MRI scanning are firstly the claustrophobic patients. Roughly 1 in 8 people has some difficulty lying in a tube, whilst some may make it, others don't. And the others are the ones in whom we specifically want weight-bearing scans to not only see what the problem is in the spine, but to see the effects of gravity on that problem. There are many other patients in whom the upright MRI scanning is better than a supine scan. Some patients can't lie on their backs because of their level of pain. It's too difficult and too painful for them. Patients who are significantly overweight may have difficulty fitting into a tube themselves, or may certainly feel that they have difficulty, and this increases their claustrophobia. And in certain patients we want to see not just the scan in a static view, but to have some dynamic pictures with the patients bending in certain directions. Many patients who come to see us have already had MRI scans done elsewhere, lying down, i.e. in the supine position. In a number of those, either because the patient was in too much pain lying down or because of general claustrophobia, the quality of the scan could be inferior. Those patients do very well with the open upright MRI scan. In other cases, we want to identify pathology that the lying down scan simply doesn't show, and probably in about 25% of patients we can identify that. The scans we obtain on the upright MRI scan are every bit as good as those we obtain on any other type of scan. Some magnets have a much higher field, 1.5 Tesla or even 3 Tesla, and the disadvantage of those scanners is they can cause artifact on the pictures, that is, identifying structures and features on the scan which aren't actually there. But on top of that, the report that's issued, usually within 24 hours, is created by an expert in upright open MRI scanning rather than just conventional MRI scan. The radiologists who produce these reports have had specific training on the upright open MRI scan, which is of course very different to looking at scans from a supine scanner. All the major health insurers will cover the upright MRI scan. The patient needs to obtain a pre-authorization number from their insurance company to allow them to have the scan done, and that just involves a simple phone call through to their insurer.